I'm Juliette Goodrich, in for Elizabeth.
I'm Ken Bassita, and we begin with the big pause in the use of the Johnson & Johnson COVID vaccine and what it really means here in the Bay Area. The concern comes after cases of blood clots, and there have been 6 out of more than 6 million doses delivered. 6. One woman died. People's symptoms developed 6 to 13 days after receiving the one-and-done shot.
So far, 7 Bay Area counties have announced they're temporarily shelving the shot, including Santa Clara, where about 60,000 people have already received it. New at 6, our Devin Fehely joins us live from Levi's Stadium. And Devin, you would think this has left county health departments scrambling right as they're trying to ramp up vaccinations.
Yeah, you might think that having to pull one of the 3 approved vaccines out of circulation would be, if not catastrophic, at the very least, very disruptive. But, you know, Johnson & Johnson was the last to be approved. They've had some manufacturing issues, a bad batch of 15 million just last week. And so the bottom line is Bay Area counties didn't have much. They weren't expecting much, and they are taking this temporary pause in stride.
The county system and other providers will pause the administration of the J&J vaccine.
Dr. Marty Fenstersheim says Santa Clara County will shelve more than 13,000 doses of the Johnson & Johnson vaccine until the CDC can determine it's safe. The bigger challenge, he says, is reaching out to the more than 60,000 people in the county who've been vaccinated with the J&J shot, warning them of potential side effects like blood clots.
We certainly have utilized that one shot and done vaccine in places where it might be difficult to get people back. And since all of this just happened this morning, we are absolutely working to make sure that we outreach the communities.
Across the Bay Area, the one-shot J&J vaccine was often used to vaccinate the homeless, a group that advocates say is especially vulnerable due to its lack of access to medical care.
Unless there's a lot of information and there's a lot of care given to this, a lot of attention paid to it, there's going to be people that maybe get the shot, develop symptoms, and don't know what it is, and many people here don't even go to the hospital. I've seen it.
The Johnson & Johnson vaccine was the 3rd to be approved in the U.S. and represented a small portion of the Bay Area's overall stockpile of vaccine. More than 13,000 doses in Santa Clara, nearly 4,000 in Alameda, 1,200 in Marin, but just 500 in San Mateo and San Francisco, for example. Public health officials say they'll switch J&J vaccine appointments to Pfizer or Moderna. A small bump in the road, they hope, to expanding eligibility to everyone 16 and older.
Our county health system staff have been working tirelessly for this moment. We've built the infrastructure and the capacity, and now finally supply has arrived.
You know, Devin, Santa Clara County announced they were getting 300,000 additional doses from the feds. So will that lessen the impact of the Johnson & Johnson vaccine that's being pulled?
Absolutely. Public health officials here in Santa Clara County described that one-time infusion of 300,000 doses from the federal government as a game changer. They're basically going to have to pull about 13,000 Johnson & Johnson out of circulation. On the other hand, they're getting nearly 300,000 additional shots, and so they like that math. Now, all of the other counties are not in that exact same position, so they'll have to figure out how to use those other 2 remaining vaccines to replace the Johnson & Johnson appointments that they've made.
Yeah, fortunately, there is other supply coming in. All right, Devin, thank you. And for the latest vaccine news and information on how to get an appointment, check out our resource guide, kpix.com/vaccine.